The cardinal symptoms of respiratory system are cough, expectoration, hemoptysis, expectoration of blood or bloody sputum, chest pain, pleural pain or pain of tracheitis, breathlessness, wheeze or stridor. Other symptoms are hoarseness of voice, heaviness in the chest, fever, swelling of feet, in chronic CO or pulmonal, epistaxis, nosebleeds. Symptoms related to ear/nose/throat, example sinusitis, rhinitis, running nose, sneezing. Syncope, example cough, syncope, bone pain, hypertrophic osteoarthropathy or rib pain in bronchogenic carcinoma, altered mentation, respiratory failure. General symptoms, appetite, loss of weight, pulmonary tuberculosis or bronchogenic carcinoma, fatigue, sleep, bladder and bowel. Upper respiratory tract extends from external nares to the junction of larynx with trachea, up to lower border of cricoid cartilage, and includes nasal cavity, nasopharynx, sinuses, oropharynx, and larynx. Lower respiratory tract includes trachea, lobar bronchus, segmental bronchi, generations of trachea, bronchial tree, and alveolar air sacs. Scheme of examination. Upper respiratory tract, URT. Nose, congestion, discharge, hypertrophy, turbinate, bleeding spots and polyp, and nasal septum, deviation, ali nasi, nasal flare. Mouth breathing, example adenoids or pursed lip respiration, example COPD. Air sinuses, examine for tenderness over maxilla, ask the patient to sit and lean forward whether any heaviness on forehead is complained or not. Pharynx, throat, gum, teeth, palate, posterior pharyngeal wall, postnasal drip, nasopharynx, tonsils with oral hygiene, halitosis present or not, larynx, could not be examined, examined by direct and indirect laryngoscopy. The motto of examination of URT is to determine whether it is healthy/unhealthy, or favoring aspiration or not. Examination of the chest, lower respiratory tract. Inspection. Shape of the chest, movement of the chest. Apical impulse, stand on the right side of the patient and look tangentially over precordium. Respiration, rate, rhythm, type, depth, and breathing pattern. Venous prominence. Fullness or depression. Unilateral or bilateral. 2. Localized or generalized. Supraclavicular and infraclavicular fossae. Whether both the nipples are at the same level or not. Whether accessory muscles of respiration are working or not. Wheeze or stridor. Intercostal suction. Skin, front and back, gynecomastia, from bronchogenic carcinoma, pigmentation, sinus, example from empyema, cold abscess, or systemic fungal infection, ulcer, herpes zoster, puncture mark, any swelling, example cold abscess, or metastatic nodule, parietal edema, example amoebic liver abscess, empyema thoracis, shiny skin over empyema thoracis, blue markings for radiotherapy over sternum, etc. Back, scoliosis, kyphosis, drooping of the shoulder, winging of the scapula, gibbus, position of inferior angle of both scapula, symmetry of interscapular areas, spinoscapular distance, ankylosing spondylitis, and venous prominence. Also observe the skin condition, example sinus, over back. Any deformity after thoracic operation, example thoracoplasty, should be carefully looked for. Palpation. Surface temperature. Tenderness, rib tenderness in trauma, fracture, or secondary metastasis, intercostal tenderness or punch tenderness in liver abscess or empyema thoracis. Corroboration of the findings of inspection, examine the spinal deformity, direction of venous flow, details of any swelling present, parietal edema, etc. Position of the trachea and the apex beat, idati, position of the mediastinum. Movement of the chest, always measure the expansion of the chest by a tape in full inspiration and in full expiration. Vocal fremitus. Any other palpatory findings, i.e., palpable accompaniments like friction fremitus, bronchial fremitus, palpable coarse crepitations, subcutaneous emphysema, palpable pericardial rub. Percussion. Conventional percussion, shifting dullness, coin percussion, right, left hepatic and cardiac dullness, lost or not, both are lost in emphysema, delineate the upper border of hepatic dullness along the right MCL. Auscultation. Breath sounds. Vocal resonance, __, diminished or increased, whispering, pectoriloquy, egophony. Adventitious sounds, __, rhonchi, crepitations, and pleural rub. Miscellaneous, __, succussion, splash, posttussive suction, etc. It is better to auscultate all over the chest without leaving any space unexamined. Never forget to examine the upper respiratory tract and the back and respiratory system. No examination of the lungs, however carefully performed, should be considered entirely satisfactory or final, if made in the recumbent position.